You're 31, you're healthy, you're a dietitian, and then you're told that you need a total gastrectomy. Today's episode is one of the most raw, powerful conversations I've had on this podcast. It's about navigating life and nutrition when your stomach is surgically removed. But even more than that, it's about how we show up for our patients when they're scared, confused, and facing something no textbook truly prepares them for. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. My guest today is Ilana Kersch, a registered dietitian with a deep expertise in GI and gut health. She's also a survivor of a hereditary stomach cancer. She's been both the clinician and the patient, and her story today will challenge you to reconsider what it really means to practice with empathy. In this episode, Ilana shares what providers did and didn't say that made all the difference in her cancer journey, how she managed extreme weight loss, fatigue, and malnutrition after her surgery, the dietary strategies that help patients live without a stomach, and why nutrition support shouldn't stop at discharge, how to help patients navigate dumping syndrome, dysphagia, and rapid muscle loss, and what survivorship really looks like after GI cancer, physically, emotionally, and nutritionally. If conversations like this help you feel more prepared, more confident, and more compassionate in your clinical practice, I want to make sure that you're getting my weekly newsletter. It's short, it's practical, and I write it specifically for busy clinicians like you. Every week, I share latest nutrition insights, patient-ready talking points, and tools you can use in your next exam room conversation. You can sign up totally for free at examroomnutrition.com/sign up or click the link in the show notes. So even if you don't work in GI or oncology, this is an important conversation because every one of us sees patients navigating scary diagnoses, messy recoveries, and uncertain futures. And Ilana reminds us, the best clinicians don't always have all the answers, but they do know how to make patients feel seen. All right, my friend, let's get into it. Ilana, I am so excited and honestly honored that you've come onto my podcast to share your journey and to share tips that we can learn from you. So thank you so much for being here. Welcome to the show.
Thank you so much. I'm really excited to talk about my perspective as a patient and a clinician. I kind of love talking about that dual role.
Oh my gosh, it's fascinating. And I'm sure you didn't love your journey, but I love the lessons that you've learned from it and what you can share with us. So there's so much wisdom in today's episode. So I want to hear about that. And as you were on both sides of the exam room, you're a dietitian, you're also a patient. So let's just start out by kind of sharing what is something that you wish more providers understood about working with GI patients in general.
I mean, the one thing that I really like to focus on is that sort of GI symptoms, diet recommendations, sort of everything lumped into GI nutrition is really not textbook. I think there's a lot of things that we learn. If someone has IBS, do low FODMAP. If someone has had this surgery, do low fiber. But these sort of GI conditions and surgeries are so quirky and niche, and I think every patient ends up having a different experience. So I think being flexible with your patients, with your recommendations, start off with what the textbook recommends, but if they're telling you that it's not working for them or they're not tolerating it, I think being creative and being flexible is incredibly important.
Oh, I couldn't agree more with you. And we hear that so often, even just in like weight loss tips and things that we share, like what might work for one patient, it could be harmful or just completely unhelpful for another patient. So I really like that perspective that you brought in. And so we're going to get into your story in depth, but I'm curious to hear about when you were going through your journey of diagnosis and treatment, were there anything specific that providers maybe said that were really, really helpful? And then on the other end of the coin, was there anything that was unhelpful or maybe honestly like a little harmful for you?
I wanted honesty and frankness right up front. So I wanted my surgeon and my doctors to be very clear with me as far as what's my prognosis. I was very lucky. Mine was caught extremely early, so my prognosis was good. And so it was helpful to have that going in. And I think what I would have appreciated more was more of them saying, I don't know, when they didn't know. And I've had this on the other side I've worked with GI surgical cancer patients as well. And they'll ask me things like, how much weight am I going to lose? Or how long is recovery going to take? And they get sort of frustrated with me when I say, I can't give you a clear answer. And I got frustrated too when I would sometimes hear that response. But I think being clear with people about there are some things that just are not going to be answerable until it happens is realistic. I think giving unrealistic expectations ends up causing more harm down the road.
I think that's super helpful and really important. Okay, I want to get into some nutrition strategies for our GI patients. But before we do that, I think it would be great to hear your story. If you want to just kind of walk us through, like, what were your initial symptoms that you're like, something's not right, to then the treatment and sort of where you're at today.
So mine was a bit of a unique case. I actually was diagnosed with a hereditary gastric cancer. So the journey started in 2017 when my mother was diagnosed, and we had known that her mother had stomach cancer, but I think it was chalked up to environmental factors. So we underwent genetic testing. I was found with this CDH1 cancer gene. And so I didn't actually have any symptoms. I was going for yearly endoscopies, and I was found in 2021 with a stage 1A gastric cancer. So I had no symptoms. I actually felt great. I was in the best shape of my life. And I had this scope, and I was told, great, 6 weeks from now, total gastrectomy. So I underwent the surgery, and I had some initial early complications. The first 3 to 4 months were quite challenging. I had a pretty major infection. I had to have several esophageal dilations because I was having a stricture. And then beyond that, the recovery was slow, but consistently sort of upwards from there. But it really was kind of a crazy flip to be on the other side of I had been working with patients for about 8 years up until that point, and now I was the patient and working with the dietitian. So it was pretty eye-opening.
Oh my gosh, unbelievable. Now, prior to your diagnosis, were you a GI dietitian?
I focused more on GI afterwards, but I had been doing liver transplant, a lot of hepatobiliary surgeries. I had worked with some stomach and pancreatic cancer patients. And now I've really, since my own surgery, I have focused more into just GI because I'm very passionate about it.
Oh, yeah. And you're walking in your patient's shoes. So you are the best person to give advice. You've got the evidence base and the personal journey that you've walked through. So you completely understand your patients. Okay, let's get into some of the changes that happen when you have a gastrectomy. So talk to us about that, and specifically, like, what nutrients are affected because of this anatomical change. What things do clinicians need to be aware of?
Particularly with what I had, which is a total gastrectomy, there's a lot of nutrients that are affected. As far as macronutrients, sugars, especially simple sugars, can cause dumping syndrome. So a lot of people have to cut back. Fiber can be difficult to reincorporate after the surgery. Obviously, there's much smaller reservoir without the stomach. And so anything that's more filling, like fiber, is going to be challenging. So that is a very slow process to reincorporate. Fat can be tough, especially things like fried foods or very high fat foods can cause something called bile reflux. And then getting enough protein is incredibly important, especially for the first few months after surgery. And so figuring out a way to incorporate protein. There's also a huge risk of a lot of different micronutrient deficiencies. The big ones are going to be iron, vitamin B12, calcium, and vitamin D. But there's an overall risk of all micronutrient deficiencies because of that lack of stomach acid. I wasn't really given great guidelines on what to supplement, but I have found elsewhere, I actually take all chewable bariatric supplements. A bariatric surgery is quite similar to a gastrectomy, and so those end up working for me. I think it would be incredibly helpful for patients undergoing this surgery to be provided a more comprehensive supplement list going into surgery. That's a big one because it ends up being sort of a missing piece. And then finally, hydration. It can be really hard to both get enough fluid and enough solid food in one day because of the volume restriction. So sometimes that is a little bit of a choice. Do I stay hydrated today or do I get enough calories today, especially early on?
So challenging. So what kind of labs would you suggest? Are there guidelines for that? Immediate post-op, 6 months? Are we checking these micronutrients, or do you find that that's not really general practice?
I think it depends. Certainly for me, 1 year post-op, my iron panel was checked, my vitamin B12 and vitamin D were checked. But actually, part of the reason my anemia was not caught for a while was because after that, my cancer center was not checking these labs. And I was months out from seeing my primary doctor. So I think sometimes there's a bit of lack of continuity where your primary sort of wants the GI team to deal with it. And the GI team says, well, you're cured of your cancer. We're not really your main doctors anymore. We're just checking up to make sure that your scans are still clear. So it's very easy to sort of fall through the cracks. So I think advocating for yourself and making sure that these things are being checked somewhere is important.
What a good point. And I think as clinicians, we forget that the patient's kind of like being like ping pong balled back and forth, and someone needs to be monitoring those things. So that's really, really interesting. Okay. So you mentioned a lot there. I want to unpack that and talk about some of the dietary strategies that do work best, for, for managing life without a stomach, especially like you said, a total gastrectomy. So what were some of the things that you did? You mentioned chewable bariatric surgery vitamins. What are some other things that really worked well for you?
So, first, I'll stress that it is not static. Your tolerance will change over time. They say it takes up to a year to sort of get to your new baseline. So, what you're going to be doing a month or 2 months out is not the same as what you're going to be doing 2 years out. So, keep trying stuff. Small, frequent meals is always going to be a cornerstone. It's very difficult without a stomach to eat just breakfast, lunch, and dinner. And so, along with that, I always recommend things like bars, shakes, and bringing things along with you. I always have a little pack of almonds or a protein bar with me when I'm out and about. I would say making sure you're not going longer than 3 or 4 hours without eating something. Meal hygiene, super important. Eating in a way that is sort of lower stress in a quiet environment, chewing food incredibly well, eating slower at first. Your brain doesn't immediately recognize that the stomach is no longer there. So it's very easy to sort of wolf down food the way you used to. And you don't feel it for another 20 to 30 minutes. And then the symptoms start. So there really is sort of this mental retraining process of relearning how to eat appropriately so that you don't get sick. And then food tracking, symptom tracking at first, and really identifying your safe foods. And there are foods you may think before surgery. Even as a dietitian, I thought I knew. I bought all these protein shakes and ingredients for smoothies. And for months after surgery, I kept trying them and I could not keep them down. So it's a lot of trial and error and figuring out what are going to be your diet cornerstones.
Yeah, that's exactly what it sounds like. It might be different for every patient. And so, are there certain supplements that are key? Like, I'm thinking about protein. Like, how were you able to maintain enough protein? Did you drink a lot of shakes, or were you on like a liquid diet to start with? Just kind of give us an idea, kind of immediate post op, and then maybe like 3 to 6 months out, what that looked like.
Protein can be really tricky. I struggled a little bit with the liquids. Again, I thought that the protein shakes were going to be great. And for some people, they are. But for me, they made me feel very full and bloated. I actually ended up eating a lot of cheese and still one of my safest foods. I ate a lot of plain chicken and fish. Again, a lot of nuts or nut butters. I did a ton of peanut butter and yogurt, Greek yogurt starting off. For other people, doing a largely liquid diet ends up feeling best. And I do like high protein shakes or using a protein powder or a collagen powder that you can sneak into whatever you're drinking. And then again, just making sure that you're doing those small, frequent meals and that everything you're eating has protein. You don't want to just fill up on Jello or toast or crackers because it really is a missed opportunity. Now, for hours, there's not that little bit of protein coming in.
Yeah, good point. Now, I'm curious because you mentioned that a total gastrectomy is very much like a gastric bypass surgery, which makes complete sense. But for bariatric patients, the guideline is to sort of separate your liquids and your solids. Is that a similar strategy, a post gastrectomy?
It is absolutely also a strategy, especially if you're prone to dumping syndrome or if you're finding it challenging to eat enough and not feel overly full. Definitely separating out liquids and solids by at least that 30 to 60 minutes. The first few months of surgery, after surgery especially, eating and drinking ends up being your full-time job. And it is incredibly frustrating, but you really need to be sort of sipping and taking bites all day long, because that is the only way that you're going to be able to tolerate that amount of volume. It gets better over time, but it's very frustrating and time consuming at first.
Oh, yeah. What a life change. Okay. You've mentioned dumping syndrome twice, and I want to make sure my listeners know exactly what that is. So, if you can kind of give us an idea of what is going on inside the body, and then what are some strategies to prevent that from happening?
So, dumping syndrome is a reaction that can happen after bariatric surgery or after some sort of stomach resection. Normally, when you have simple sugars or sort of these monosaccharides, disaccharides in your diet, they spend several hours slowly moving through the stomach and then eventually getting to the bowel. But when there is minimal or no stomach, those simple sugars can cause this osmotic reaction where they hit the small bowel very quickly. Water gets drawn in to try to dilute this hypertonic fluid, and it can cause either early or late dumping syndrome by sort of rushing all the contents of the bowel through too quickly. You can have things like hypoglycemia. A lot of people will get dizzy or fatigued, flushing, sweating. You can actually have presyncope or syncope. Some people get diarrhea. So it is a very disruptive symptom. It is the kind of thing that once dumping starts, there's not really anything you can do to stop it. You kind of just have to ride the wave. So the best way to manage it is prevention.
Okay. How do we prevent this from happening? Because that sounds absolutely awful.
Yeah, it's not fun. One of the biggest thing you can do is avoid high sugar items, especially beverages, because those move through so quickly. So for most people, it's going to be avoiding fruit juice and sodas, picking lower sugar energy drinks, which again, for a lot of people, if those were a regular part of your diet beforehand, it's a big change. Separating solids and liquids by that 30 to 60 minutes can help. And then if you are going to have items that are a little bit higher sugar, pairing them with other foods that slow down digestion, such as adding a little extra protein, fat, or fiber as tolerated, will sort of slow down that reaction.
So helpful and so interesting. And now you mentioned energy drinks, and it just made me think about carbonated beverages. And again, in the bariatric space, I spent some time working as a bariatric dietitian. And so we try to tell them to limit or avoid carbonation as much as possible because it's an irritant. And is it the same for post gastrectomy patients?
It is the same. People's tolerance varies, but there is also another factor, which is that for some bariatric patients and for a lot of total gastrectomy patients who have what I have, which is an anastomosis between the esophagus and the jejunum, regular plain water with nothing in it has higher surface area, and sometimes that can be challenging to swallow. But you're also not supposed to have high sugar liquids because of the dumping. So a lot of patients afterwards are, what am I supposed to drink? So what I actually do is I have carbonated beverages and then I mix a lot of the bubbles out. Some people will add a little bit of an electrolyte packet or a splash of Gatorade or a splash of juice. But yes, highly carbonated beverages can be irritating. And without a stomach, the gas doesn't really have anywhere to go. So oftentimes you sort of get this stuck gaseous feeling and you sort of have to burp like a baby, frankly, to get the gas out. So it's not super harmful, but it can be very annoying.
And let's talk about weight loss because it sounds like it's very difficult to maintain adequate caloric intake. I mean, post surgery, your calorie needs are traditionally higher, anyways, but it's also now very hard to eat that volume of food. So, what are some strategies that either you did or that you suggest for your patients to make sure that they don't have any extreme weight loss?
So, first of all, another thing that I think doctors and providers should warn patients, especially with a total gastrectomy, weight loss is inevitable. It's going to happen to everyone. The goal is to try to slow it down as much as possible and to maintain muscle mass as much as possible. So, again, those small, frequent meals, frankly, even if you're not feeling hungry, which That stomach removal also changes the hormonal picture. And so you often aren't going to feel physiologically hungry. If you can eat or even take a few bites or sips, you got to do it all day long. And then sneaking protein and fat in wherever is possible. At first, I actually recommend really not drinking almost any plain water because it ends up being a waste. There's no calories and it's going to fill you up. So either adding a protein powder to something like almond milk, adding collagen powder or a clear protein powder and drinking that instead, taking very small bites of chicken or cheese or whatever your preferred protein is. Trying to be active if possible. It's very challenging after surgery, but even if you can get up and take a 5 or 10-minute walk, that is going to help with digestion. And then just really communicating closely with the team, monitoring your weight. It's very tempting to put your head in the sand and not want to be checking your weight, but especially for those first few months, it's important to monitor.
And how often do you utilize fat? So, for kids, I usually will say, add a little bit of butter, extra cheese, maybe, drizzle their pasta with some cooking oil, those types of things. But I'm curious, is that tolerated for post-gastrectomy? Would that be a way to optimize caloric intake?
It varies a lot. I personally can't tolerate things like deep fried foods, but moderate fat like salmon and anchovies and nut butters are totally fine. I tell people to test in very small amounts at first. So, yes, if you're cooking something like plain chicken, add a very small amount of butter or cooking oil to see how you tolerate. If you're making a protein shake, start by figuring out if you can tolerate the fat-free version and then add a teaspoon or two of peanut butter or almond butter. So it's a slow process of integrating, but as much fat as you can reasonably tolerate is, of course, going to help keep the weight up.
Yeah. I love that you pointed out that you should tell patients that weight loss is inevitable, especially for your female patients. We're so deeply connected and affected to our weight that I think knowing that upfront makes it feel less like a failure if and when it happens. And I think that's a really important takeaway for clinicians to educate their patients about expectations. Are there any other expectations that maybe you wish someone would have said to you or that they did say that did happen that you were like, oh, thank God they warned me about this?
Yeah. I did this on my own and my team told me it was fine, but they didn't really push it. I purposefully gained weight and really worked out hard before my surgery. Of course, depending on your age and your situation, that may or may not be possible. But I had about 6 weeks. I gained 12 pounds. I mean, I also wanted to eat everything that I could see because I knew things were going to change. And I really tried to up my resistance training and put on as much muscle as possible because it was all gone in 6 weeks. And
Mhm.
everything I had gained and then some. So I think as much as you're sort of able, I do think the sort of pre-op nutrition optimization, the more you can push it, the better.
Oh, I love that. I think that's brilliant and so smart of you to do on yourself. But moving forward, I definitely think we should suggest that to patients that use that time wisely, but also, like you said, to enjoy too, because I'm sure there's such a huge mental aspect to this of you can't eat your favorite foods. And honestly, most foods that you used to enjoy, like your entire life is flipped upside down. So really be in that moment and enjoy all of those foods prior to surgery. Okay, I want to move into transitioning from treatment to survivorship and sort of what that looks like. How can clinicians support their patients? And is there anything special about nutrition that we need to know during survivorship?
There's a couple of things. I think one of the big things that often gets overlooked is balancing the post-surgical GI needs with any other diet conditions that the patient might have. These things don't exist in a vacuum. For example, for myself, I actually already had IBS-C before surgery. And the way I managed it for years was eating a very high fiber diet. I was actually a pescatarian, which I gave up just prior to my surgery because I knew that the protein was going to be really important. And my management strategy for my IBS has completely changed because after a total gastrectomy, that high fiber diet has never worked for me again. So if you have a client who also has IBS or diabetes or kidney disease, you need to incorporate those strategies along with the GI diet. And it can be a little bit of a tough needle to thread. The other big thing, and this is less nutrition, But the psychological factors, I think there is a sense from medical teams that once the patient is a certain amount of time post-treatment or post-surgery, that they're cured, but the patient's life never fully goes back to normal. Post-gastrectomy really has lifelong chronic symptoms and conditions that you do need to manage, things like diet changes and fatigue. It can be very slow to get back your physical fitness, if ever. And there's also things like depression and sadness over body changes, these physical changes. It can also be very isolating, especially if you don't know anyone else who has ever had this surgery. It can be difficult to explain to family members or strangers, people you're meeting, sort of what even is this surgery and what do you do to manage this? So I think understanding that survivorship really is a lifelong process is important.
Yeah. And I can imagine how isolating parties are, if you can't tolerate cake or, cupcakes or whatever is being served. It can be uncomfortable for you and the people around you. They don't know how to act around you, especially if you are on a certain diet or anything like that. So I can definitely see how that affects their entire life. We need to be sensitive to that. Okay, my final question for you is what resources or tools did you find most helpful that you wish more providers shared with their patients?
Well, first, I'll plug myself and dietitians. I think having longer term nutrition care, especially for GI patients for post GI surgery, is incredibly important. I worked with a dietitian before and after my surgery, and she was fantastic, but I only had access to her for about 8 weeks following surgery. And luckily, I'm a dietitian and I can do a lot of my own research, and it was okay. But I do think having more resources for patients for long-term assistance is really important. If that's not available, I think at least having some resources that are reputable available for patients. There's a ton of misinformation out there. And so if you just have some links or websites that provide basic information about this GI condition, a grocery list or meal plan example. I even recommend Instagram and social media pages that are run by dietitians and gastroenterologists that provide reputable information. So at least patients have a basic idea of where to go to look for ideas. I think that would be hugely beneficial.
Okay, so where can people find you on social media? And then maybe if you want to name drop a few of your other favorite pages or even websites that you used a lot during your treatment.
So you can find me on LinkedIn. And currently, I am seeing GI and other patients through Nourish via telehealth. So please come find me if you or any of your patients have GI needs or have had a gastrectomy and want to talk to someone who's done it. I love seeing patients who have gone through what I have gone through. I am currently working on building my own private practice. So, to be continued. As far as social media resources that I love, there is Jessie, the IBS dietitian. She provides fantastic information. Some other great GI-focused resources include Monash University. They've done a ton of low FODMAP and IBS diet research. Everything on their website is validated and reputable. There is Kate Scarlatta. Her website, blog, social media presence is fantastic. You can always go to gi.org, which is the American GI Association, and they have lots of great resources. And then I love Body Foods. If you are sort of in the IBS FODMAP camp, they have a ton of great products that I like to use and recommend. But there are tons of different resources out there. And I would say in general, if it's from a gastroenterologist, a dietitian, a registered nurse, a PA, I would always go with that rather than random health coach.
Oh, yes. Beautiful place to end because I talk about nutrition red flags and misinformation all the time. So thank you so much for those resources. Ilana, thank you for sharing your journey. Thank you for being so brave. And we have just learned so much from your interesting perspective. So thank you so much for your time and for being here.
Thanks, Colleen.
All right, now it's time for my nutrition notes. If you found Ilana's story helpful, I've got a few past episodes you'll definitely want to check out. And I'll link to all of them in the show notes so you can listen to them when this episode is over. First up is episode 49, titled The Biggest Cancer Nutrition Myths. I sit down with oncology dietitian Julie Lanford to tackle some of the most common and frankly, confusing questions patients ask when they're first diagnosed. We dig into everything from, does sugar feed cancer? Should patients go on keto or low carb? Do soy foods cause cancer? Is organic really better? And what about supplements and probiotics? You'll love this episode if your patients are asking these common questions because Julie brings the evidence and helps you answer these questions without feeding into the fear. Next up is my 2-part series called Ask the Dietitian, where the usual style of my interview podcast is switched up a bit. You'll find them in episode 56 and 57, where PA Dane Thomas joins me and Julie Lanford for a practical Q&A on cancer nutrition strategies. In episode 56, we get into the weeds on how to help patients manage treatment side effects like weight loss, nausea, diarrhea, reflux, and more. And in episode 57, we focus on cancer survivorship. What should patients eat to prevent recurrence? Should they avoid meat? How much does BMI matter after cancer treatment? We unpack those big questions that every survivorship care plan should address. Also, after listening to this special series, can you let me know if you want more like them? Conversations between RDs and clinicians. If you do, send me a DM on Instagram at examroomnutrition, or just shoot me an email at colleen@examroomnutrition.com and let me know because I can easily set that up. And don't forget, if you want these kinds of resources delivered straight to your inbox each week, sign up for my newsletter at examroomnutrition.com/sign-up. Well, my friend, that's it for today. Thanks so much for bringing me along on your commute, your walk, or wherever you've carved out time to learn about nutrition. I really appreciate you being here. So, as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.